Welcome to Health+Tech, the podcast where we explore the law that applies at the intersection of healthcare and technology. Hosted by McGuireWoods, episodes feature healthcare innovators and updates on the laws that apply to digital health businesses.
Welcome to the Health+Tech podcast. I'm Kristen McDermott Woodrum, a healthcare partner in the Atlanta office of McGuireWoods and the co-lead of our digital health, technology, and innovation practice. Today, we are excited to welcome to the podcast Ambar Bhattacharyya, Managing Director at Maverick Ventures, a global investment firm that has been investing in early-stage companies for over 25 years with a focus on healthcare and technology. Prior to joining Maverick in 2015, Ambar worked at Bessemer Venture Partners, Bain Capital Ventures, Minute Clinic, acquired by CVS, and Bain & Company. He's received broad recognition for his leadership, including Fortune Magazine's 40 Under 40, Business Insider's 30 Leaders Under 40 Transforming Healthcare, and is a global shaper by the World Economic Forum. Ambar currently serves on the board of one public company and several private companies. He holds an MBA with distinction from Harvard Business School and a BS in economics and BA in psychology from the University of Pennsylvania. Welcome, Ambar.
Thank you so much.
Thank you so much for joining us. That's an impressive background. So to kick us off, can you tell us about your professional background? You spent some time consulting at Bain before getting your MBA and landing in venture capital at Bessemer Venture Partners and now Maverick Ventures. Can you talk about your professional journey and how it led you into healthcare?
Absolutely. I think for me, a lot of my professional journey has been intertwined with my personal journey. And so for me, I'm the son of immigrants. My parents both immigrated from India, from Calcutta. They met in the U.S. and I was born in Washington, D.C. My dad's a physician. And so we grew up in this physician household where everything we did was in and around healthcare. My dad practiced as a neurologist. My mom worked in his office as an assistant and running all the admin functions. And my sister and I, we would chip in and we would help do whatever was necessary. Sometimes it was dictation. Sometimes it was helping with stacking files. Like whatever we could do, we would help. It was like our own little family business. And we spent a lot of our lives, moving around the U.S. from place to place. So we spent some time in West Virginia, some time in rural California. And really, healthcare was kind of the centerpiece of what we did each and every day as a family. And so it 100% intertwines with my professional journey. After going to college, like any son of a physician, you think about being a physician, but I decided pretty early my fear of blood would not allow that to happen. So I joined Bain & Company right after undergrad, and I immediately gravitated towards healthcare clients. Something that was familiar to me, something that I knew, and then all of that mental preparation, which was really, really organic, right? It was just kind of part of who I was. Led to a little bit of serendipity. One of my clients and cases at Bain & Company required me to really understand all of the innovation that was happening in and around the Medicare Modernization Act of 2003. This is one of the first transformative pieces of legislation that had happened in certainly in my professional career. And as part of that, I was studying all the different things, the ramifications of that. Medicare Part D, the infamous donut hole, and coverage for drugs. But there was one really interesting company that popped up on my radar back then, and this was what was then a small little company in Minneapolis called Minute Clinic, and it really caught my attention. It had transparent pricing. It was staffed by nurse practitioners. It was open on nights and weekends, and I really overlaid that with a lot of what I knew about the healthcare practice, which was works 9 to 5. Mostly staffed by physicians, certainly not open on the weekends, and billing was quite opaque. And I thought this was a super innovative idea, and so decided to take a leap of faith and and joined Minute Clinic pretty early on, and got to see them through their growth path. The company obviously was acquired by CVS soon thereafter, and that's what led me into my venture capital career. The lead investor in Minute Clinic were the folks at Bain Capital Ventures, so I got to know them really well from my time at Minute Clinic, and they asked me if I wanted to join them, and that's how I transitioned into career in venture capital about 15 years ago.
That's a great story. Thank you for sharing. And moving forward, you were an early investor, and your funds were early investors in some really disruptive healthcare startups, including One Medical, CityBlock, Hims and Hers, that are really transforming how healthcare is delivered and paid for, much like Minute Clinic. Looking back, what were your expectations in making these investments, and did things play out according to these expectations?
It's a really great question. So going back to those days at Minute Clinic, one of the problems, I think there's two problems we were really solving there, but it turned out we were solving more. One was a problem around access to healthcare. And this was, now we talk a lot about healthcare deserts and, places where people have no access. And I think it was, the Minute Clinic, we centered in and around convenience of how to do that. But there was a second vector here, which was around affordability. How do you actually make sure healthcare is affordable? And then the third vector, which we really had to prove, and I think in a lot of these models, the onus is on the companies to do is prove that the quality it would be the same as well, and to make sure that for the additional benefit of convenience and access at affordable in affordable ways, you'd be able to get that in a high quality manner. So I think those are that's like the triple aim in some shape or form, right? And I think a lot of what we've done here at Maverick is looking for innovations in and around that. Telemedicine is one of these areas, and we've tried to examine how telemedicine can transform the landscape of healthcare, almost from a myriad of different angles. So you think about it from the perspective of the commercial population. I mean, One Medical really was at the onus of this, or at the beginning of this, right? Where, booking same day appointments, next day appointments with high quality physicians, not just having one physician's office, but having, a cluster of physician offices, was really, at the time, was extraordinarily transformative. Very akin to Minute Clinic model in many directions. Obviously, one now acquired by Amazon, one now acquired by CVS. You can see how that, how each of those became extraordinarily strategic to larger companies trying to increase their healthcare breadth. But I think there's other ways of doing it too. I mean, you think about Hims and Hers, as you mentioned. We were seed investors in that company, and part of the the thesis behind that was thinking about how consumerism would drive healthcare. I mean, it's a buzzword that's been around for a long time, but I think the insight we had there was in and around affordability, actually, where such a large percentage of Americans today have high deductible health plans, and those folks are essentially in a cash pay economy, where the average deductible is in the thousands of dollars, and you are basically out of pocket, for most of the year, unless you have some sort of large healthcare event happening. I think that was a really interesting insight that folks at Hims and Hers had, saying if folks are in a cash pay economy anyways, how do you actually deliver an offering that has the the benefits of access and affordability while remaining high, while having high quality. It was a unique insight, very contrarian at the time, to think about the world that way. And CityBlock, just to touch on that for a minute, really similar concept where there was just such little innovation happening in the Medicaid market. And we knew from our times at One Medical and Devoted that primary care innovation can save money while doing great for the patient. and no one had actually aimed it at the underserved market before. And that really attracted us to it. It's very well suited for value-based care type models. And so, that's what led us to spin that company out of Alphabet and get it off the ground.
Those are all great points. And you've highlighted some of the key pain points in healthcare that are being addressed increasingly through investments. Through this journey, were you surprised by the traction and success these companies achieved, or by any kind of unexpected challenges or headwinds they faced along the way?
I mean, all of them, have plenty of them, and I think it's all the credit goes to the management teams to help, help overcome them. I think some of the more frequent ones that we face for any truly innovative company is, how do you overcome a lot of the inertia that exists in the macro healthcare market? There are a lot of incentives to, unfortunately, in the healthcare ecosystem where lack of change is rewarded, and each of these models is disruptive in their own way. And so, I think we faced we face a whole host of challenges, and different companies have overcome them. One of them is, how do you get providers comfortable and to work in a value-based care arrangement? For most providers of most of their careers, it has been a fee-for-service type environment. And then often, over the last 2 decades, there's been a big shift from running independent practices to now being employed by larger health systems or large insurance companies, where you've gone from fee-for-service to being employed. So it's actually 2 different shifts that have happened. And so this is the third shift, which is, how do you actually think about this from a preventative care perspective, population health perspective, where the economics are tied into preventative health? I think that's one big challenge, and it continues to be an evolution. I think the second one, which is hard, is unfortunately for us in the healthcare system today in the U.S., for most of the population, this is, I'll exclude Medicare fee-for-service from this. Most people have the option to switch their health insurance every year. So whether in commercial world, where you can switch during open enrollment from one employer to another, or one insurance company to another, on the exchange, you can switch, pick a different plan every year. MA, Medicare Advantage, you can do the switching. That creates again a natural disincentive for people to make long-term investments. So that, by people in this case, corporations, to make long-term incentives around preventative health. So much of what it'll take for this country to switch from a sick care system to a healthcare system is around creating those incentives for that. So I think one thing that we've tried to do, throughout all of our portfolio companies, is to extend the LTV, for the patients or the consumers, such that we can show that a dollar invested today in this patient or in this community will actually lead to many dollars, not just in year 1 and year 2 or 3, and that is actually a calculus that is sensible for someone to do. And that's a big challenge. Like, not a lot of people wouldn't necessarily agree with that, given the shifts, given open enrollment every year. So those are, a few of them, right? That kind of maybe fundamental type things that we've dealt with. Yeah,
and no small feat to overcome those. And kind of along those lines, Maverick Ventures invests in companies across healthcare and technology sectors. So you've spoken a little about sort of looking ahead, but what kind of strategy is driving your investment decisions today?
Yeah, we tend to be very thematic investors. So the way that we approach themes is twofold. One is, we think about the large mega trends that we identify, and the question we ask ourselves is, for all of the technological advancement or regulatory advancements happening in any given year, what are the top 2 or 3 of those, and how could they change the world over a 10-year time period? That's kind of like our top-down view of it. On a bottoms-up basis, what we do is we try to talk to as many stakeholders as we can in and around those megatrends. And so here we talk to dozens of folks who are either potential customers, current customers, innovators, large companies, regulators, you name it, we will try to talk to them. And that's a big part of what we do, is kind of that deep, marrying that kind of top-down macro view of, where's the puck going, to solidifying that with real tangible evidence from folks who are on the ground either building or buying. And so today, when we think about some of these big mega trends, and where we're focusing, I mean, there's a few that there are a few that we think are. I think we've been early to them. We could talk about that a little bit more, but we think certainly all the things in and around artificial intelligence, certainly certainly makes up for a big mega trend in the future, particularly generative AI. We do think all the innovation happening around GLP-1s, it does seem very transformative to us in terms of how people think about weight management, how they think about nutrition, and so we're thinking about that very deeply. And then third, thinking, even deeper in and around this trend of at-risk providers. How do you continue this transition? I think from fee for value to fee for service to fee for value. I think we're probably in the, a few years ago, we'd say we're in the early innings. I think we're now in the middle innings of that transition. And so those are, three mega trends that we've followed, and we're trying to supplement in that top down and bottoms up way.
Yeah, I think I agree with all of what you just said, and have personally worked in the area of value-based care and care innovation, and finally feel like it's getting some recognition and traction, not just among those in certain markets that may be a little ahead, but just across the board. I think people are tuned to what's happening. So you have to look at the trends and project, far out, because you're looking at the seed rounds and Series A, Series B rounds of investment for these companies that you're kind of helping to form their future. What advice do you have for those early stage companies looking to find an investment partner? And, as an investor, what are the early signs that you're looking for that a startup may be poised for some success and growth?
Yeah, so there's two questions in there. I'll take the first one. How do you try to find a good match between an entrepreneurial team and a set of investors? I think it's a threefold answer. One is I do think there has to be a meeting of the minds, right? Where there has to be some joint belief that the future vision of the world that the entrepreneur has is more or less in line with the future view of the world that the venture capitalist or investor has. And the reason for that is, one of the guiding principles, even as a former operator, is that there needs to be a shared true north, right? Like, this is where we want the world, what we want the world to look like in 5 years, 10 years, 20 years, 30 years. And if there's no shared true north, then you'll end up disagreeing on a lot of fundamental pieces. And so that's kind of, number one, is make sure you have that. Number two is, really calibrating on what you want that relationship to look like. Is this a thought partner you want to iterate on the idea? Is this someone you want to help you recruit people to your team? Is this someone you want for customer introductions? Is this someone you want to play devil's advocate all the time? It's always all of the above, but really, what's stylistically, what are you looking for? And is that firm well known for that? Is that partner well known for that? Those are the kind of things, that, I would counsel folks to do. And best way to do that is through founder references, talking to other folks people have worked with before. I think the last part of your question is, was how do you what do we look for, right? In these early ventures, we tend to be very early stage investors. We invest in the seed rounds, we invest in the Series A's, early Series B's. We incubate companies, we spin companies out. We do a lot of creative stuff at that early stage. And so it's hard for us to have a set rubric for that. We tend not to say it has to have X amount of revenue or any revenue, or Y number of customers or zero customers. I think we actually are far more open-minded on those metrics and on those things. But what we do look for is our unfair advantages, things that will lead to moats over time, and particularly places that we think have been under-innovated in, that have, in other words, been very neglected. And we want to be amongst the first people to innovate in that space. And you see that hopefully with companies like CityBlock or Devoted Health, where we were Series A investors in, Centivo that we seeded, really transforming a lot of that employer-driven healthcare space. Those are the kind of things that attract us. People who want to really, really dent the universe of how we think about the healthcare ecosystem.
That's very interesting. Are there any red flags that you've learned to identify?
I think the red flags is for us is in and around integrity. That's number one for us. These tend to be decade-plus relationships, and I think that at the foundation of all of that is trust. And so we tend to be a pretty open bunch of people here, and we show our warts all the time, and and that's just part of who we are. But the quid pro quo is that we expect the same. We don't expect perfection, but we expect honesty. We expect integrity. And that's the primary thing, and is around trust.
Yeah, absolutely. So we've talked about some opportunities to address problems in healthcare, and there are lots of problems in healthcare. And a lot of these opportunities are centered on the use of technology and can help all stakeholders, patients, clinicians, health systems, payers, life sciences companies. Where do you see the biggest opportunities for technology to help solve some of these problems? And are these the areas where you're seeing investment being focused?
Yeah, I think so. I mean, I'll use this as an opportunity to talk about some of the advancements in artificial intelligence that we've seen, and particularly around generative AI. And the reason I go there here is that I do think there has been this almost stagnation of innovation over the last 20 plus years in healthcare, where a lot of great technology has been created, and some of it has been adopted by the traditional healthcare system, but it hasn't completely moved the needle, right? In terms of healthcare costs, which keep going up year after year, healthcare quality, which by some metrics, life expectancy in the U.S. has decreased, over the last few years, and I think the problems in around access and affordability and quality remain as high as ever. You think about health equity, a super important issue. It's so dramatic here in the U.S., of course, globally too. So there's a risk that if you're if you have a hammer, everything looks like a nail, right? So stating that in the beginning as one case, but we do think that AI and generative AI in particular have a lot of opportunity to solve some of these problems, and I think there's ways that they can solve them in a more of a point solution type way, and there's probably ways that they can solve them in more of a transformative type way. And we actually bucket into three different categories here at Maverick on the generative AI side. So on category one, we think about this as healthcare specific large language models. So these are LLMs that will be trained off healthcare data, used in healthcare cases, whether clinical or admin in nature. These would be kind of on that foundation layer. Category number two is the application layer. So these are companies that would be using generative AI to do something that is being done today that is a little bit more manual in nature. So classic examples here, you'd be thinking about prior authorizations, note taking, et cetera, et cetera. And then category three that we think about are, I'll call it the moonshots. These are things that perhaps would not have been possible even 12 months ago that are now possible today, potentially possible today, but you have to look at it on a multi-decade type basis. Things that I would put into this category are things like AlphaFold, right? Where you're looking at protein folding in a way that was not possible, 12 months ago. You think about a future version of the world where you're able to marry an individual's medical information, genomic information, proteomic information, and potentially marry that with generative AI. What could the future of precision medicine look like there? And I think it's an interesting question that is just beginning to be asked, much less answered. So those are the three broad categories we look at here. And in each of those, I think there are different ways of innovating, both on clinical applications and admin applications. And as you flesh out each of those, I think there's so much promise in terms of how healthcare can be streamlined, how it can leapfrog, particularly outside the US. I think it's those kind of use cases excite me a ton. But even in the US, you're seeing a lot of top-down momentum from the boards of large incumbents, from those management teams that are willing to adopt this, given it does seem like a generational shift. There's a lot of watch outs, data biases. Are you actually continuing the healthcare system that's flawed today by ingraining it into the data set? There's so many different issues. Regulatory, how do you deal with that? Do you let how does the industry play into regulation? Huge question. How do you think about open source models versus closed source models? There's so many different nuanced questions in here. But again, once you zoom back out and think about what the promise could be in either of those three buckets, it is hard for us not to feel incredibly excited about what the prospects could be.
Looking at the prospects, in what areas do you think there are kind of the biggest challenges for adopting tech solutions or AI, utilizing AI to its potential?
Well, let me start with where the state of the world is today, and then where some of the challenges come in. And so I'll talk about an investment we made in the generative AI space as maybe as an example of that. So last year, we invested in a company called Mosaic ML. And Mosaic ML is the generative AI company that focuses on two things. One is building open source large language models, and then secondly, thinking about GPU orchestration. How do you actually get access to a lot of these chips that are necessary to train these models? And one of the unique things about Mosaic, and I think this will get at your question, is because they were an open source model, they were able to get traction with folks in regulated industries in particular. One of their first clients, and this is public on the blog, were the folks at Stanford Health System, where last fall they used their Mosaic's open source LLM to make their own LLM at Stanford. It's called PubMed GPT, was what it was called back then, where it essentially just crawled PubMed, the repository for peer-reviewed medical literature, and they made their own LLM to do that. What was astonishing about this, and one of the reasons that led to our investment was, the two, Stanford and Mosaic came together, and in a period of 6 days, they were able to create a new LLM. It was super affordable, less than $40,000 to build this new LLM, and the quality was phenomenal. At that point in time, it was just trained off the PubMed repository, was nearly at the level of passing step one of the USMLE, and got a 95% hit rate on the yes or no questions. Truly phenomenal. And since then, other LLMs have surpassed that. the Gatortrons of the world and NYU Trons and MedPalm 2 and others who now have gotten to a super high pass rate on the USMLE, 80 some percent, 90 some percent. And so when you think about that, I mean, this has all happened in the last 12 months. You now have multiple large language models being able to replicate what a doctor has been able to do, certainly on tests, right? And certainly on the admin side of things, there's a whole bunch of other innovation happening. And so then the question is, what do you do with that? And that kind of gets to your inertia question, or the challenges question. Like how does the system react to it? There's 2 or 3 refrains we've heard a lot, which is AI going to replace doctors? There's this huge fear out there that that's going to happen. That isn't the framework that we have out there, but although we acknowledge that is a fear. The way that we think about the question is, will AI provide superpowers to clinicians, where they're able to ingest all of the medical literature that is being published on a monthly basis that no one has the time to read and synthesize? Will AI be able to give real-time second opinions? Will AI be able to give an ability for better patient communication? And we've already seen literature being published that talks about how in survey data, patients have preferred the communication style of these large language models over how clinicians today have practiced. We just think about these as superpowers, right? The job of a clinician is so complicated. The panels have only gotten bigger. The meta types of cases that they're dealing with are only harder. But if you can put in the power into the pocket of these clinicians, the superpowers of every piece of medical literature in real time, from peer-reviewed journals, being able to do some of these things, we do think it is a leapfrog opportunity. You have to do it in the right way, right? Because there's a lot of inertia to them from a regulatory, legal, provider perspective, reimbursement, always follow the money. Like, how does this get paid for? How does it not get paid for? But we do think if you zoom back out, all of that innovation on that generative AI side can lead to 3 fundamental things that we do think there is alignment for. One is in a fee-for-service based model. It should help payers and providers and pharma companies do business more efficiently and become more profitable, which should be a shared goal. Number 2 is in a value-based world. This should provide an overlay that should, again, with the right models, without the biases, all that stuff, which is super important, but it should be another layer in and around population health or precision medicine that should help prevent folks from visiting the hospital before it's too late. And then number 3 is from an affordability perspective. This is a way to deal with the affordability issue, right? I mean, this is being able to supplement clinical time with technology should allow healthcare to become more affordable and hopefully bend that cost curve. So that's how we think about the challenges and why hopefully they'll be overcome.
Yeah, sticking with the AI, I know earlier this year you co-authored a report where generative AI meets healthcare, updating the healthcare AI landscape. And we've discussed there's tremendous buzz around all things AI, and a lot of hype there. And you've gone into some very compelling examples, but can you break down further the AI hype? Kind of what are the key developments that you think everyone should kind of be aware of, and what areas are you very most excited about?
I mean, it's in those three categories I mentioned before. I mean, in that paper, I think we wrote that a few months ago, and as fast moving as the generative AI space has been, I actually think the 2x2 that we put into that report still holds to this day, where we do think there are low-hanging fruit examples that will be adopted sooner versus later. Things like note-taking is a really good one, and you're seeing lots of great players build solutions for that. from folks like Nuance and Microsoft combined, folks like Abridge or Ambience or Suki and others have built Nabla. There's so many companies that are working on that, and it is totally leapfrogging what was possible 24 months ago. It is wild. You take the flip side of that example too, where we think about note taking as a passive thing that happens in every single physician's office. But with the flip side of that is conversational AI, where your ability to talk to someone, and this would replace IVR, right? So this is your classic example is you called United Airlines and you say, hey, I want to change a flight, press 1, give me your reservation number, or hold for an operator, and you're talking to a robot today. That happens, of course, in a lot of industries, but in healthcare, it certainly happens, whether it's pharma hub services, members calling insurance companies, calling, hospitals calling insurance companies, physician, it's just the myriad of conversations here or there, or plenty. We think that conversational AI is low-hanging fruit. Something will happen here, and I think it's and it'll be adopted sooner than later, particularly for the admin stuff. You think about scheduling, rescheduling type purposes, those kind of things. I think should happen. And then 3 is in and around areas that are just very human oriented tasks that don't necessarily need to be. So think in and around prior auth and things of that sort. You look at some of the work that Doximity did in the early days. By early days, I mean a couple of quarters ago. All within this calendar year. But their ability to real time use generative AI on behalf of physicians, really drive engagement in that platform. And showed, V1 of what that can look like. So we're looking at all those areas, right? And that's kind of, that's I'll call it that application layer. The places that we'll do a lot there, and I think a lot of venture funding will go in there as well. But I do think those categories 1 and 3 are the ones that are really, really fascinating. Will there over the course of time be a healthcare specific LLM for different purposes? And by healthcare specific LLM, it could be one that is just for the call centers, right? That is just trained for that. It could be one that is focused, fine-tuned only for a prior auth type task. It could be one just for cardiology, one for just oncology. It could be one just for specific health system. There's a lot of different variations of that. And, broadly speaking, in the generative AI world, there's this back and forth of, what will rule the days? Will it be one large model, the OpenAI, Anthropic type model that will be the one size fits all for everything if you can fine tune it? Or will it be smaller models that are cheaper to run, that are fine tuned on specific data sets? That battle is playing out right now. And so we're studying it, right? I mean, we're studying it to see which way it goes. And then the moonshot stuff, gosh, like that's the kind of thing where, that's category 3, where it's really hard to imagine what the world might look like there, if some of those things are true. And we had our annual meeting at Maverick. We had actually a 30-year anniversary last week at Maverick, and one of our guest speakers was Sam Altman. And we asked Sam the question of what does the future hold, right? Kind of broadly speaking. And his answer is one that I share is when you have something as innovative as this, some of the innovations that come out of it are ones that will be hard to perceive today, because the technology is moving so fast, things of that sort. At the advent of the internet, advent of mobile, advent of the telephone, it was very hard to think about different use cases that are now so obvious to all of us. But some of these moonshot ideas will fall into that category, and we're spending, even if that happens over multiple decades, it's a place that I think deserves a lot of attention. We're spending a lot of attention to, and so that's that's how we're spending our time in this space.
Thank you for sharing, and congrats on that 30th anniversary. That's huge. Are there any other investments or areas you want to highlight?
I think another area that we've spent a lot of time on, and I think it's just at the tip of the iceberg in terms of what can be done, is in and around how employers have dealt with the healthcare cost inflation of the last 20 years. This has been a theme that we've been interested in, and there's been a lot of great companies that have been created over the last decade in two categories. One is, are there alternatives to the existing insurance companies that dominate that market? And these are examples like a Centivo or like a Garner, like a Collective Health, that I think have provided a far more affordable, consumer-centric, high-quality way of thinking about care for employees across the U.S. And that, by the way, that's $1 trillion of spend. If you look at what employers spend on healthcare per year, it is an enormous market. But we also think that there's a lot more opportunity in that space. There's a lot of models that have been proven to work today that have not yet been applied to that employer market. I'll give you one example. In the Medicare space, there's a lot of, we'll call them advanced primary care type models that have been shown to bend the cost curve. So think of the ChenMeds of the world, the Ioras of the world, the Allidays of the world, which have just done an exceptional job of having MLRs, in the 60s and 70s, which are just really, and sometimes very, very hard populations. So the question is, can you think about applying that to the commercial world? And are there ways that you can take some of those models and apply them to the commercial population or adjust them slightly? Certainly companies, some companies have approached this, the One Medicals and Premises and crossovers of the world. But we think there could be another wave of that, that is truly primary care-led innovation in and around bending the cost curve for employers. We think, secondly, from a segmentation perspective, there's been a lot of attention in the last few years in and around mental health and behavioral health, and just so many great companies have been created there. We think that has set a blueprint for how companies can grow in the space. And so we're looking for other areas that are high spend, under innovated in, that can leverage that blueprint that has been created to deliver value for employers and employees. And lastly, this theme of consumerism. We've been fortunate to, as you mentioned before, to be early investors in some really transformative companies in and around consumer, whether it's One Medical, Hims and Hers, 1MG in India. And we do think there remains an opportunity for injecting some of that consumerism into that market segment. Very, very, very oddly, like you're seeing a lot of consumerism in the direct-to-consumer path and even Medicare, obviously with the exchanges, right? That's one-to-one marketing, but it hasn't quite reached that level on the employer side. And so we're interested in that. Another place we've been really, really passionate about is health equity. This is a word that's not uttered often enough in the VC community, but we think there's the health equity issue in this country is unfortunately only health inequity, I should say, is only growing, and it's a real tragedy. And we do think there are ways that capital can be used to help address that issue. Companies like CityBlock go a long way. We have a company called Belong Health that serves a dual eligible population. We think go a long way. We seeded a company called Mira, which serves the underinsured population. But there's just so much more that can happen there. And part of what we want to do is see if there are ways you can leverage technology and just really innovative ideas, whether whether that technology looks like generative AI or whether that technology looks like giving everyone a cell phone, right? There's a lot of different ways you could do it, telemedicine, being one. But are there ways you can solve that health equity issue? I mean, my thesis is yes. And we'd rather be an early mover in that area, and help solve that issue. And that's part of like the mission driven aspect of what we do too, right? And we think there's the bar is so low. It's so low. It's tragically low. And so great entrepreneurs who want to build in that space, we want to meet them all.
That's fantastic. So looking forward, we've covered a lot today. So I'll wrap with one final question, Ambar. Is there anything you want to highlight that you're most excited about just looking over the next 5 or so years? I mean, things are moving very fast. So kind of looking down the line a little bit for your portfolio companies or just for future healthcare technology investments.
I think we've talked about a lot of it. I mean, the one place that, one other place we've been spending a good amount of time is thinking about what the future of pharma is. And we touched upon this a little bit when thinking about, GLP-1s and some of those, mega blockbuster drugs that have been created. But if you zoom back out, there's so much data that now exists today that 10 years ago didn't exist, in terms of one, biology, certainly just under our understanding of the human body and what makes it work. Two is, how clinical trials work from a recruitment perspective, enrollment perspective. And then 3, around real world evidence, like things that are being captured. We think there's a lot of opportunity to reinvent how we think about the word precision medicine. This has been a word that, I remember when I went to undergrad, I think there was, precision medicine, was a word being tossed around 2 decades ago. But I do think this could be the era of it. And so that's one place we've been really excited about. And that takes form, sometimes that means life science innovation, right? A new diagnostic, a new tool, maybe a new drug. It certainly means thinking about how pharma companies view the world in a data-driven way. And some pharma companies are better off, more prepared for that future. Others are still playing catch up. But that's a place where we think on a 5 to 10 year basis, the way that a lot of drugs get developed, a lot of drugs get marketed, the types of people enrolled in these trials can just look really different, and in a good way, in a really good way. And we think that hopefully our ability to help, partner with some entrepreneurs who want to do that will lead to better outcomes along the way.
Well, thank you for sharing all those insights. I've really enjoyed learning from you and hearing about Maverick's strategy and your mission. It's all very impressive, and I look forward to tracking what you're doing going forward. Ambar, thank you so much for participating in the podcast today. Is there anything you want to highlight in terms of research, blogs, publications, outreach for our listeners today?
Yeah, I mean, for us, we try to be available to entrepreneurs who are building. Easiest way is to find us, or through our website at maverickventures.com, on LinkedIn. But we just love talking to entrepreneurs who are building. So find us if you're there.
Well, I hope we can make some connections. And thanks to everyone listening today. Appreciate you joining this episode of the McGuireWoods Health+ Tech podcast.